I have always been interested in the biology, how the human body works, the mechanics, and I was lucky enough to have mentors who supported me and encouraged me to be a surgeon. You know, it's an absolutely fantastic feeling to help people, help the patient, free them of pain, give them the quality of the life. So, on the other hand, the surgeon job is very interesting, very exciting, requires lots of skill, lots of knowledge. The surgeon must have a good leadership quality, has to make a decision very quickly in the different surgical situation. So in summary, this is a lovely job and I just love it. I have been working at Practice Plus Group Hospital in Barlborough for 20 years. I am a primary hip and knee surgeon. I also do the knee arthroscopies, and my little favorite is the hand surgery. The best part of my job, probably I love the post-op 6 weeks clinic, because I can check the outcome of my procedures. I can meet with lots of happy patients, and on the other hand, I can monitor the outcome of my surgeries. So the pathway is before the patient comes to our hospital, we mail a few documents for the patient, questionnaire that the patient has to fill in. So when the patient arrives to the hospital, goes to the reception and submits these documents which was filled in previously. The first assessment is with the surgeon. What the surgeon does that we are going to take the patient past medical history, the social life, the family circumstances, and we ask different questions about the affected joint. Afterwards, we have to examine the patient joint and send the patient to the X-ray or check the X-ray which is already available for us. The protocol in our hospital that we have to have a 2 X-ray about every joint, but if this X-ray was done in another hospital prior to pre-assessment, day before the surgery, the X-ray department requests this X-ray from the other hospital, so we don't have to repeat the X-ray. This X-ray is valid for 6 months if the patient condition hasn't been changed. And the next step is the physical examination. We use the various tests to examine the joint, where is the pain, swelling, stability, range of motion, and so on and so on. And we check the X-ray and the imaging, sometimes MRI scan, sometimes CT scan. We discuss the X-ray with the patient and we give a full view about the condition of the affected joint for the patient. And we give treatment options for the patient, that these are the options how we can treat this special condition. And we try to give always the personalized treatment advice for the patient. And we have to agree with the patient that what is the best option for the patient, best treatment option. And finally, we have to go through the consenting process, when I have to explain that the surgery is going to be done in such a way. These are the complications of the surgery. This is how we are going to do the post-operative physiotherapy, rehabilitation. This is what you can expect. And we have to leave the patient to ask questions, just to make sure that the patient got the full information about the condition and about the treatment what we are planning. And at the end of consultation, we sign the surgical consent form with the patient.